How are you? Well, I am today with Dr. Noelia Bonfanti. Noelia, she's a top nutritionist in the field of sports nutrition and is also a really good friend. We met lots of years ago. And well, I appreciate so much that she's here because I know she's super busy with her athletes and all the teaching and stuff she does in the university as well. So, well, thank you so much, Noe, for being today with us. And well, I let you introduce yourself as well, if there's anything you want to tell about you or to our moms.
Thank you so much, Olgi. I'm glad to be here connected with you today. So, no, I think you already said the most important about me, and looking forward to share what I know about nutrition in pregnancy, and especially when the pregnant women are doing exercise.
Yeah. So, well, thank you so much again, and we just go into detail with the educational video. So, my first question for you is, well, normally, when someone is pregnant, it's really common to encourage her or to tell her eat for two. And well, recently, and for the last few years, we know that this is not good. And I just wanted to demystify this quote that we always tell women eat for two. So my question is, why would you like we should stop saying this?
Okay, that's a very good question because that's already something that's still something that people is saying, and I have a lot of patients, pregnant patients, saying that okay, but now I am gaining a lot of weight, and I don't want to, but I know that I have to eat for two, and I don't know what is happening with my body. So the real thing is that we really don't need to eat for two. Our energy expenditure increase, that's for sure, but it's not going to increase in the first trimester. It's going to increase in the second and the third trimester. So that's something really important because we are not even looking for an increment in the body weight in the first trimester, which means that we really don't need to increase the energy intake regarding our energy expenditure. So that's something really important to start, that we don't have to expect for an increment in the body weight. So we really don't need to eat for two. So what is really happening in the body is that we are needing more nutrients, of course, because we are creating a little life in there. But in the first part of the pregnancy, this requirement is really low because if you think about the composition of the baby, to call it in a nice way, it's really small. It's not going to demand a lot of energy, and that's something that happened in combination with the feeling that the pregnant women have about I want to eat more because I'm feeling different and I'm feeling something different in my body. My psychological background is also changing because now I have a person in myself. So that's kind of sometimes a way to say, okay, I am allowed to eat more. And I'm okay if I am gaining weight right now. So
Yeah.
it's like something that people is really using to do like a compensation to what they are trying to do.
Yeah, and yeah, as you said, it's kind of the perfect excuse when you're pregnant.
Yes.
Like, oh, it doesn't matter. I know I'm gonna put on weight. So, well, it's okay if I eat not that healthy or if I eat more processed food or more sugar stuff.
Mm-hmm.
Because while I'm pregnant, I have cravings, so I am allowed. So, well, it's really good that you told us, especially that in the first trimester there's no an increase in the energy requirements, and that it only happens in the second and the third trimester. So, well, we will. Well, actually, that's gonna be my next question, because you mentioned that in the second and the third trimester is when we probably request more energy, because obviously that in the second and in the third trimester is when the baby is growing more, especially
Mm-hmm.
like around 20 between 18 26 weeks there's like there's a peak in the fetal growth, and there's another one towards the end. So probably in that time the baby's demanding more energy. And yeah, so my question is, how which are the energy expenditure requirements, and if we need to modify our energy intake in those
Okay.
trimesters.
That's also a good question. And the answer is always it depends. But because it really depends of each person. The first thing that we need to pay attention is the current body weight. So what we are talking about to a need, we need to increase the energy expenditure, but we need to increase the energy intake regarding the energy expenditure, but we need to know how the body weight of the patient is, of the pregnant woman is, because if we are having a reduction in the body weight in the first trimester, because this seems sometimes happen, especially when the person is having a lot of nausea or vomits, and we are not able to absorb all we need. So maybe the increment is going to be higher, because we need like to recover the weight and the energy that we were losing in the first trimester. Then, if we have a person with overweight or obesity, of course, we are not going to be doing an increment in the energy intake, because we are trying to reduce the problems and the consequences of having overweight, because this we know that is going to affect really bad to the baby and to the baby development. So then if we are talking about the normal weight person, pregnant woman who is doing the right progress, and in the first trimester she didn't increase nothing or 1 kilo or something like that, we talk about around 360 kilocalories in the second trimester, and a little bit more, almost 500 kilocalories in the third trimester. But again, it's going to depend of the evolution of the body weight, and it's important to highlight that this is something that we have to do regarding the energy requirement, the real energy requirement. So if we were eating 2,000 kilocalories, because 2,500 kilocalories, and we were spending with exercise 500 kilocalories, for example, but now because something changed, I can continue doing the same exercise, or I can increase doing more exercise, so my energy expenditure is going to change. So we always need to put these extra kilocalories regarding to what I am really spending. I don't know if I was clear.
Yeah, so if I got it right, you were saying that obviously we need to think about the the weight gain across the pregnancy, depending on if I put on too much weight. Obviously, I'm not gonna increase my energy intake. That wouldn't make any sense. But if my if my gestational weight gain is going according to what is supposed to be, my energy intake can increase. But if I'm not doing the same exercise as I was doing before, then obviously my energy intake
It's going to be
gonna
in the
be
same place,
yeah,
exactly.
yeah, because I'm not expending all that energy because I'm not moving that much.
Exactly. This is important to clarify, because a
Yeah,
lot of people saying, okay, now I have to eat 400 kilocalories more than what I was eating in the first trimester. But it's not like that. You have to increase regarding to what you are spending in this moment.
yeah. So
If
it
you
has to
increase
be.
because you are exercising more, you are going to be increasing even more than 400 regarding the first trimester.
Yeah,
But
so
if
we
you are
need to.
reducing your exercise, so you probably don't need to eat nothing extra.
Yeah, and that's really important because normally what happens when you're pregnant is that your physical activity levels or your exercise levels are going to be lower than your or compared to your pre-pregnancy state.
Depends of the person, right?
Yeah,
Because some
well,
people
yeah,
is
for
really
some.
sedentary at the beginning, but yes, that's true. Yeah.
Yeah, I mean that the normal trend is for them to reduce their exercise levels, but as you said, there might be some sedentary women that they didn't do anything before the pregnancy, and then when they get pregnant, they start moving because they realize it's really important. So in that case, they will need to increase their energy intake according to what you said.
Exactly.
It was 365 in the second trimester.
360
Oh, 360
in
second
the first
trimester.
one, and it's I always round it in 500. It's 475 the recommendation, but it's almost 500 kilocalories extra
In the third
the third
trimester.
one. But that is also important to say that it also this is going to depend also if they are doing exercise all days or not. Because if you are resting completely one day, so your energy intake has to be different to the day that you are exercising. So that's always important to know that I'm not going to eat the same every day. My energy intake is also going to change depending of the exercise that I am doing every day. But that's the same for everybody, and it's the same for pregnancy, for pregnant women.
Yeah, that's really interesting because we think, okay, the recommendation is to have that increase in my energy intake per day. That's per day, right?
Yes.
Uh, so I'm gonna eat a little bit more, maybe like, well, probably I'm talking too much now, but it can be maybe like one more piece of fruit during the day, or
Well,
something.
a little bit more
A
for
little bit, okay.
yes, for 500 kilocalories. You are talking about then we have to decide the nutrients too. But in general, for you to have an idea, you are talking a big plate of pasta with some fruits and some proteins. So it's kind of a lot, 500 kilocalories. But that is
Okay,
what we used to spend, for example, in one training session in average. So if
okay.
you know this, but for you ladies who are watching this, for you to have an idea, a typical person running 1 hour at 10 kilometers per hour. Sorry, you talk about miles, right? And then Olga,
Well,
you can.
10K, 10K, 10K,
Okay.
it's okay, yeah.
But that's around 500 kilocalories spending. So imagine that you one day you are running or doing a class with Olga, and the other day you're doing nothing. So you are going to have this different in your energy expenditure. So that's something that we need to pay attention to when we are eating.
Yeah, it's really, yeah, really, really useful. And I don't think, well, or at least I didn't think in that way. I thought, okay, I increase my energy intake every day, regardless of how much I spend. Because obviously, when I exercise, and there are going to be days that maybe I'm been working all day, and last thing I want to do is to do exercise after working. I just want to relax, and I'm going to be sitting down.
Yeah, and easy way to think about this and to understand it is you think that the day that you are not doing exercise, if you still increase 500 kilocalories, at the end you are going to be increasing 1,000 kilocalories because you are going to be spending 500 kilocalories less.
Plus the
You
ones
know
you're
what I
eating.
mean?
Yeah, yeah, yeah.
Exactly. So at the end, your energy intake is going to be higher in 1,000 kilocalories because you are spending 500 kilocalories less. That's why we need to find the balance every day. In the practical way, it's easy because if you teach the pregnant woman to do it, they just know how to change the carbohydrates amount, especially every day, regarding the day that they are training or not. And it's a practical thing to do. It's not so complicated.
Yeah, well, that's really good. So, well, my next question was related to exercise. So, is there anything we have to have in mind when we're exercising in relation to how we eat? Is there anything we have to, or any considerations that we have to make before or after doing exercise?
It depends. It's going to depend a lot of the type of exercise that you are able to do, of course, because we were talking before, it depends a lot of the training capacity of each one. So if you are, this is your field especially, but you all the time told me that it depends on how you were active before, right? So that is gonna change how you can do it during your
Yeah,
pregnancy.
yeah, of course, like depending on how much exercise you've done
Exactly.
before, then we have to either progress or regress the way you do exercise when you're pregnant. So you were talking about, for
Yeah,
example, the intensity is not going to be the
exactly.
same. Yeah.
That's why the nutrition is going to change also depending of that. Because if you are going to be able to do a high intensity exercise with or a lot of high intensity components during one training session, that means that you need to be sure that you have enough carbohydrates before. And of course, after, we always need to recover that carbohydrates if we use them. Because if we were doing like a really light training session, we were using a lot of fat but not carbohydrates. So then if we start to eat a big plate of pasta because we think, okay, I was doing exercise, I need to recover my carbohydrates, maybe we are eating a little bit more of what we need. So before, we need carbohydrates always, and the amount is gonna depend of the intensity and the duration of the training. After, I would say that the most important nutrient is always proteins, because
After
proteins
training.
need, yes, and this is something that is going, protein have to be also before, because we know that all people, and especially in pregnant women, we need to provide proteins in every meal, because this is a way to maintain the muscle mass. Because if we are not giving to the body amino acids, that these are the small blocks forming the protein, we know that we are like reducing the capacity of the body of maintain the tissues, and especially maintain the muscle mass. That's why we need to be sure after each training session, we need to be sure that we are providing proteins, because we are recovering everything, especially if we are carrying a baby.
Yeah. Yeah, and well, and we do loads of well, in our training sessions, we always do strength, a part of resistance and the strength.
So even more, because you know that you are oxidating more fibers, more muscle fiber. And then proteins are this. If you put this into the practical meals during the day, so it's easy, because you know that every meal should provide proteins, because this is the key nutrient for a good pregnancy and for a good development of the baby.
Well, great. So, well, we've said little bit of carbohydrates before exercise
Mm-hmm.
and protein after exercise, especially if we've done some strength training.
Mm-hmm.
If we
Exactly.
do, is it the same if we do, sorry, cardiovascular training? Should we take proteins after?
Yes, because even if you are doing cardiovascular training, you are oxidating
We do. Yeah.
some amino acids in the muscle, and especially because even if you are not doing exercise, you need to be sure that every meal that you are doing during the day is providing proteins, because it's the key nutrient to the development and the growth up of the baby and for maintaining your own muscle mass. So you never need to take off the proteins of one meal. It's not really a need for that, not even if you are resting. If you are resting, you reduce or change your carbohydrates intake and sometimes the fat intake, but not the proteins.
Okay, great. And well, I have two more questions, the last ones.
Yeah.
Um, well, they're related, but I'm gonna go just for one. Is there any essential food that we must eat? Like there's something that we say, okay, this you have to eat during the whole pregnancy.
Okay. And that's a very common question, because everybody is asking the same, and it's really, and I like to have that question, because it's the response for me is something that we need to change a little bit, because it's not really a essential food that we need to eat. It's more like essential nutrients that we need to
Yep.
eat. So we need to find the way with food to provide all the nutrients that we need. That means that we can provide the nutrients in different ways. So some foods are really rich in some nutrients, which is going to be good to have them every day. For example, we need vitamin C, and we know that orange is one of the key foods for vitamin C, but it's not really something that if we don't eat orange, something is going to happen. We just need to look for the way to provide vitamin C with the rest of the foods. So we need to talk about proteins for sure. We need to be sure that we have enough iron, folic acid, vitamin C, omega-3, calcium. But of course, some of you probably are thinking, but I am taking that in pills.
Supplements,
Yes,
yeah.
the supplements, and that's okay. But we need to be sure that also the diet is providing enough, because a lot of supplements are thought, thinking that are thought, sorry, trying to also do like a supplementation, how the word is saying that, of the diet. So we need to be sure that we are still providing enough nutrients with my foods. It's not only about the pills that I am taking.
Yeah, so the
That's
supplements. Oh, sorry.
no,
I
no,
was about to say
no.
like,
That I was going to say that means that we always need to be sure that we have dairy products. That if we are not vegetarian or vegan people, we need to provide meat, chicken, to be sure that we are having iron and vitamin B, B12, especially this one that in some vegetarian person is really easy to have a deficiency. And then to be sure, of course, they eat fish. And then we need to look the kind of fish and the contamination with mercury. How do you say mercury?
I think
Mercury.
it's the same. Yeah.
Mercury, right?
Or
Yes, I think it's mercury the word in English.
yeah.
If not, we can look it in the Google Translator.
Yeah, yeah, for example, like with tuna, swordfish.
Exactly.
Yeah.
Because we need to be sure that the fish that we are eating, okay, they are providing omega-3, but sometimes they can be contaminated. So we have to, this is more like a safety measurement, but we need to be sure that they are really well cooked, that they are not raw, to avoid another kind of contaminations and all the specific things that we need to take care in the pregnancy.
Yeah. Yeah, well, sorry, what I was about to say before, like the fact that we are taking supplements, that doesn't mean that we are substituting the food.
Exactly. If
Yeah.
you take a look to the package of the supplements, they always say something
We
like,
don't replace.
exactly, this is like something complementing your diet. You shouldn't stop eating the right foods or something like that. Is the
Yeah, like
message.
it's not a replacement. Yeah,
Exactly.
that's really important because, as you said, you can be thinking, "Oh, I'm already taking my iron tablets because my midwife gave that to me," but you have to keep taking your normal
And especially with,
iron.
yes, your normal micronutrients in diet. And iron is a good example because we know that every iron that we are taking from supplements is not really easy to absorb. The body doesn't know how to use it. But when we are eating iron from meat, it's the best way that we have to provide iron to our body because we have a, in English, is that we call meat factor. It's like something that we know that the meat has that is making the iron to be used for the body, and that is not going to happen with any supplement. That's why some people, and especially pregnant women, at the end probably need some injection. Injection.
Transfusion.
Yeah, yes, no
I don't know if you
transfusion.
mean. Okay.
No, no transfusion, no blood transfusion. It's
Okay.
like to put iron with a needle,
Like
directly on the
intravenous.
blood. Yes, intravenous, exactly.
Okay.
Because
Wow.
that's the only way to be sure that the extra iron is coming to your blood.
Like
Because
straight.
it's,
Yeah.
yes, that's
Wow.
why always foods are the best way to provide the nutrients.
Yeah. Can you give us a few, like for example, of a few examples of those foods that will provide the nutrients that we need?
Yes, but one for calcium is the easy one because all dairy products are really full on calcium, milk, yogurt, cheese,
Cheese.
of course. Then we should decide what kind of cheese, depending of the fat content. And then you also have right now a lot of products in the market that are made for vegetarian people or vegan people, like plant-based beverage. But if you choose this kind of beverage, you need to be sure that they are fortified with calcium. So this is another option to provide calcium, to take a soya beverage or almond beverage, but they have to say this is providing or this is fortified with calcium. That's another way to take it. That's for calcium. That for omega-3, we have seeds and we have fish, and not much more than that. So sometimes it's even better to decide to take a supplement because is complicated to be sure that we are eating fish every day and a fatty fish providing enough omega-3. That's why sometimes the supplement is a good option to complement diet.
Plus the, yeah.
Yes, and because it's really difficult for people to be eating fish every day. So I don't know, only people living in the North Pole or something like that. But how do you call in English Esquimales?
I don't know.
Have no idea. Okay, the people living in the snow,
In the
you
North
know.
Pole, yeah, in the is it igloos? Yeah.
Igloos, exactly. So that people is eating fish every day, but they have a lot of deficiencies in other nutrients. So that's why sometimes omega-3 is good to supplement, to use a supplement. Then for folic acid, you are probably, all of you were taking in the first part of the pregnancy, because that's something that we do to prevent, because you know that you have to take folic acid as supplement even before you get pregnant, because this is really important in the first weeks. So if you get pregnant and you didn't know about it and you were not taking folic acid and you had a deficiency before, you are going to have problems with the baby. But then if we stop to use the supplement, or even we reduce a little bit, we need to be sure that foods like the green leaf vegetables, legumes, all the whole grain foods like whole grain bread or cereals, brown rice,
Rice,
and
okay.
especially legumes and the leaf vegetables, they are the best sources of folic acid.
Okay.
And for iron, that I didn't say, for iron is easy. For iron is meat.
Yeah, you
And
said before,
chicken, or
yeah.
the red meat especially, chicken is also providing some iron. And then you have a lot of foods in the market right now that are also fortified with iron too.
Oh,
Like some milks with omega-3 and iron. So we are having new products that, okay, they are also good to try to provide more iron to diet.
oh, good. Good to know. And my last question: is there
Yeah.
any? I will say food this time because I'm not sure if it's nutrient or food. Well, you say we always talk about nutrients, but is there anything we should avoid?
Good question. Yes, a lot of things. Sorry. The first thing that we should avoid is alcohol.
Yeah. Well. Yeah. Yeah.
Yeah, but sometimes I probably forget to say this, and I was having consultation with pregnant women who didn't know about it, because they think, okay, but if I can have probably one glass per day, and that's something that is not going to affect. And yes, it's going to have some effect, even if you don't know about it, or even if you
Yeah.
don't see nothing when the baby came.
Yeah. But
So
yeah,
alcohol,
it's been related to
malformation, yeah,
damaging brain development as well. So
exactly. That's
yeah,
it's like it's similar to cigarettes, to
to
smoke.
tobacco. Yeah.
Yes. So that's something that we really need to be sure that we are not doing, and not even with the cigarettes, not even close to the person smoking. And then this is something that it can be kind of controversial, but I say to all my patients that they shouldn't stop using sweeteners.
They should stop.
The, yes, they should stop. They should avoid sweeteners, any kind of sweeteners, because we really don't know how they affect to the baby. And right now we have some of them that are like some organisms is saying that they are safe to take during pregnancy, but in other countries they are not safe. So that's something that to me is calling my attention. Why in some countries and they are saying okay, and the other one are saying this is not good for you when you are pregnant. So,
Yeah.
and we still don't know how the sweeteners change the microbiome in our microbiome in the intestine, in the colon. So that means that if we know that they are changing the microbiome and they are changing our bacteria, but we still don't know how these bacteria are affecting our pregnancy. So my thinking is always like try to avoid it, because you don't really need them. Is you are pregnant during 9 months and then you have the lactancy period, you can have a lot of foods and try to avoid this one, because we really don't know what is happening. Even if some of organisms are saying, okay, you can still take sucralose. That's something that is better to avoid.
Yeah, because when you see, and I agree with you, it can be confusing and it can pull out some red flags because, as you say, in some countries they're banned, like, or they don't recommend pregnant women to take sweeteners. But I've seen some, I think we had this conversation before, like I've seen some recommendations from some countries, and one is the UK.
Yeah.
If you go to the NHS guidelines about nutrition in pregnancy, they say that they are not associated with any harmful effects during pregnancy. But and as you said, we really don't know because that hasn't been tested in pregnant women. We're not going to take a pregnant woman, we're going to give them lots of sweeteners and then see what happens. We are not going to do that.
Exactly.
There are probably studies with animals, but that hasn't been tested in humans. So if we don't know what's happening or what can be the effect, I wouldn't risk it.
Exactly. And that's the main
It doesn't make any
yeah.
sense.
The majority of the studies are usually done like, okay, we do like retrospective study, and we take a look if the pregnant woman were taking some sweetener. We do a food diary in the past, and then we know if they are having any issue right now. Okay, they are not having any issue in some percentage, and that means that if they were taking any sweetener, it's okay. But what about the rest of the people that we are not measuring? What about the people who are not in that study because they are not really big studies to say that this is safe for everybody? And a lot of sweeteners are are being sold, are being sold even before we have a lot of information about them. For example,
Stevia, yeah.
stevia. This is
Yeah.
our English, guys.
Well, they know they
But
deal with me every day, so yeah.
okay, so this is a kind of sweetener that we really don't know if it's going to affect or not, even to anybody. But the same with the other ones. And we are having more and more studies about how they change our bacteria, and that's something that we know that our bacteria is the second brain. So this is going to change everything, and it's also going to change the bacteria of your baby when we are having the baby at the end. So that's something that we should avoid. And so if sometimes you have something with a sweetener, no worries. It's not something that one day, it's not like alcohol, but it's something that you should start to pay attention, especially because probably we are eating a lot. Because if you are eating a yogurt and you choose the low sugar version because you want to reduce the sugar in your diet, which is good, but you are eating one with sweeteners, then you are going to, you're probably using a marmalade, and you choose also the sugar free, and you are eating sweeteners, and you are drinking a beverage or something light because you don't want the sugar, you have sweeteners again. So they are everywhere. And even some beverages, because it's cheaper to use sweeteners than sugar, they are also using sweeteners. So pay attention to how much are you eating
Yeah.
during the day.
So how can we? Yeah, maybe I'm exceeding with my questions, but because, well, just because our personal situation, we and I know because you taught us really well, we always read the labels in the
Yeah.
when we buy food. And I found out here in the UK, I don't know, well, they don't in not in all the products that you buy, they say all the ingredients.
Really?
Yeah. So, for example, when we try to look at if there's any fructose or any sorbitol or things like that, it's hard to find because in some of them they don't say. Uh,
But it's not a law
Under
to.
law, I don't know. I don't know. I mean, I know in some of them you see them, but in some of the products you don't see it, or they don't say. Maybe it's because they
Okay.
don't. Maybe it's because they don't. It doesn't have it. But I was surprised. So what can we do? Should we choose the products that they say no added sugar, or is that safe?
Oof, that's a tough one because I was sure that they have to put all the ingredients in the package. So if you are saying that that's not happening, so I would not take it you know?
Yeah, because I know,
Be-
for example, in some yogurts, it say just milk. It's like, well, but
Only.
yeah,
So it's saying milk, and it's not saying like they are putting anything else, and not the probiotics, for example. Okay,
no.
that's strange. We can do a research in what is happening in Wales.
In the
I would
market.
not take it if I'm not sure that they, because if you are taking a sugar-free version of something and you feel that or you taste and it's sweet, that's something that is telling you something that they are using something to make it sweet. So if they are not putting it in the package, that's not good. So I will I would use rather the food that I know the brands that you can trust on the brands and then you know that they are putting every ingredient in the package. So that's the best thing to do. For me, how I see the pregnancy period is like 9 months that I should do the best for me and for my baby.
And
And
if you
as
can
you
start
are,
before, if you can start having those habits when you start planning your
yeah,
pregnancy, even better.
yeah, and especially if you are not sure about something, don't take it
Yeah.
because you
Well,
have other options. Always, you have other options. You are gonna have other yogurts to take, for example. You can always drink water or sparkling water if you are looking for something different. But you don't need to go for the new Coke or any kind of that beverage.
yeah. So, well, yeah, and that was my last question. Like, if there was something we needed to avoid.
I think
But
that's the most important. Then you have the specific requirements in each person, depending of the test, depending of the this disease that you had or not, like toxoplasmosis.
hmm,
So then you probably have to take care more about the cooked products or the cooked food, the raw vegetables or the meat and etc. But that's more specific in each person.
yeah, yeah, because yeah, it depends if you have
Then you
much
have
data.
diabetes, and then you have to take care more of other things. Maybe you develop a kind of diabetes during pregnancy. So that's already pathologies related to pregnancy that we can do a lot
And we
of.
normally, yeah, and we normally, if you are in that situation, you normally have a consultant doctor who's taking care of
Exactly.
the specific situation. So it's more, I mean, in those cases, obviously, it's more specific, but you also have more support from the healthcare
Yes,
system.
but I think it would be good for all, not because I'm nutritionist, but I think it would be good that all pregnant women, they should go to a nutritionist too. Or at least to have some advice, because if the doctor
Yeah.
is saying you have diabetes during pregnancy, you should stop eating carbohydrates, and it's not like that. So you should take care more about how you are eating that carbohydrates, in which moment, which kind of carbohydrates, and how are you combining them. But it's not about to reduce everything that is high in carbohydrates.
Yeah, it's not just stop eating pasta or rice.
Exactly. Or even fruits. Yeah.
Yeah. So well, that was all my questions.
Okay, a lot of
It
questions
was
and good
intense.
questions. So.
Yeah. I know it was intense, and I'm sure. Well, I've learned a lot, and I'm sure the girls I'm gonna learn loads as well. So, well, ladies, I hope you have listened to this point at least, and we will see you soon in the live session. So you will have Noe live in person for you to ask her anything that you need. Okay, so well, thank you so much, Noe,
Thank
for
you so
sharing
much, you.
this
And I
moment
really looking forward to the live session,
the live session.
because
Yeah,
when they are, I love to work with them because they are the ones pregnant. We not, we are not
yeah, we're
yet.
not.
And it's also somehow you probably have a lot of questions to ask that we probably didn't think about. So we are gonna use a lot this session, I think.
Yeah, we all are gonna learn. So, well, ladies, thank you so much. Thank you, Noe, and well, have a
Bye
good
bye.
morning, afternoon, or evening. Bye bye.